Thank you for joining us and welcome to the webinar COVID-19 Testing and Reporting, our fourth York Region webinar in the series Making the Workplace Safer. I would like to note that the information in this webinar is current to the best of our knowledge, and with information rapidly changing on COVID-19, please continue to check with York Region Public Health and the Ontario Government for up-to-date information. Next slide, please. So my name is Tivian Gunaraja, and I will be today's moderator. I am a certified public health inspector, and I'm currently working as the acting manager of the Workplace and Community Exposures team. It is my pleasure to also introduce our presenter, Dr. Leon Genesov. Dr. Leon Genesov is a public health physician with York Region Public Health. He joined York Region in April 2020. He was previously the chief physician at the Ontario Ministry of Labour, and he retired from the Ministry of Labour in 2019 after 35 years of service. Dr. Leon Genesov is a Royal College specialist in occupational medicine, as well as a certified family physician. He is a recipient of the Queen Elizabeth II Diamond Jubilee Medal and a recipient of the Ontario Volunteer Service Award. I would also like to introduce Vito Shafari, who will be assisting Dr. Genesov in the question and answers session. Vito has been working in public health for over 3 decades with extensive experience in many health protection programs, including tobacco control, food safety and enforcement, and recently gained significant knowledge in the Reopening Act legislation as a result of his current position. Next slide, please. So this meeting will be recorded. During this meeting, you will have the opportunity to contribute or ask questions, and questions will be gathered and sorted to avoid duplication and ensure the best response. Although your name will not appear on the screen to attendees, producers and presenters may have access to that information. And if you do have any questions about the recording of this webinar, please contact hiocommunications@york.ca. Next slide, please. Thank you. So to ask a question, you can select the Q&A icon on the top right corner of your screen. You can type your question in the compose box and then select send. And it would be very helpful if you're able to identify your business sector when posting a question. And that way we can screen the questions and pose them to the presenters. Following the main presentation, we will be having a question and answer session. Thank you, and now I'll turn it over to Dr. Leon Genesov to begin the presentation.
Thank you, Tiff. Next slide, please. Thank you. The York Region Public Health would like to thank all employees and employers in our community who continue to practice excellent public health measures to stay safe while at work. The purpose of today's webinar is to discuss COVID-19 testing and reporting for employers. To help reduce COVID-19 transmission, depending on the workplace setting, employers are required to screen employees and others when entering the workplace. So most screening is by active or passive questionnaire. Other types of screening include rapid antigen testing, which we're discussing today. The rapid antigen testing can be performed by a health professional or by a trained individual anywhere on site, at the place of employment, for example, and does not require shipping a specimen to a lab for processing. It takes about 15 minutes to yield the result, and that's why it's such an advantageous test. The Ontario government recently announced the launch of a new rapid testing portal to make it easier for essential businesses to access free rapid testing. We encourage businesses to review the eligibility criteria online and register at the website you see on the slide, ontario.ca testing on site. Now, for eligible businesses in Aurora, Markham, Newmarket, Richmond Hill, and Vaughan, with fewer than 150 employees, please contact your local Chamber of Commerce or Board of Trade. If your business is not in one of these municipalities, please order from the Ontario government portal. The federal government is also offering free rapid tests to eligible organizations, and these are usually large businesses. And information is available on the federal website, as you see on the slide. Now, Organizations should notify York Region Public Health before implementing a rapid antigen screening program. Antigen testing may be performed 1 or 2 times per week during step 3 of Ontario's reopening plans. So you'd be doing the rapid antigen testing 1 or 2 times per week on each employee. Rapid antigen screening involves collecting a sample from an individual who does not have symptoms or known exposure risk. That's really important. We're collecting samples for rapid antigen screening from individuals with no symptoms and no exposure risk. Any individual who is currently symptomatic, for example, showing signs of COVID-19, or someone who is a contact of a confirmed case, should be directed to an assessment center to obtain a diagnostic test instead of a rapid screening test. Rapid antigen tests should not be used on anyone who has recently recovered from COVID-19, and while there are exceptions, in general, should not be conducted in an outbreak setting. So you may not want to start rapid antigen screening when an outbreak starts in the workplace. Really, you have to start ahead of time and really to prevent outbreaks. Rapid antigen screening does not replace public health measures such as symptom screening, physical distancing, masking, and hand hygiene. All these have to continue at your workplace. The rapid antigen screening is a layer of protection on top of that. Next slide, please. If an employee has a positive antigen test, so you've implemented a rapid antigen program in your workplace. If an employee has a positive antigen test, they are considered at that time a probable COVID-19 case. In this situation, an employee will need to get a follow-up lab-based PCR test done within 24 to 48 hours of the positive antigen test. And the test will need to be done at a COVID-19 assessment center. The test confirms if an employee currently has COVID-19 or not. While waiting for the results, the employees must self-isolate and advise close contacts. So anybody with a positive rapid antigen test must self-isolate and advise close contacts and make an appointment at an assessment center for a lab-based PCR test. Self-isolation includes employees staying away from the workplace and isolating from household members. If employees cannot self-isolate in their current living arrangement, they may contact, or you can help them as employers, you can contact Access York or email accessyork@york.ca. So eligible residents can access financial assistance and free private accommodations for isolation. Now, for any close contacts who are fully vaccinated and at least 14 days have passed since their second dose, and they do not have any symptoms of COVID-19, if they are close contacts and fully vaccinated, generally they do not need to self-isolate. York Region Public Health strongly recommends that employers continue to report individuals testing positive on rapid antigen tests to us through the reportable disease notification form available on the website, on our website. Right. So if somebody in the workplace does screen positive with a rapid antigen test, please complete the form on our website to let us know. Next slide, please. So lab-based PCR testing is also available for employees who are showing COVID-19 symptoms, right? So as I mentioned, people that screen positive on rapid antigen testing need a lab-based PCR test, and any employees who are also showing COVID-19 symptoms should be tested with a lab-based PCR test at a COVID-19 assessment center. Testing is available by appointment. Appointments are made generally online at many sites in York Region, which are noted in the presentations. We've got a list of assessment centers here on the slide. And we also have a graphic about the self-isolation center in York Region that supports York Region residents. So testing is available at the assessment centers for other individuals also. So anyone who is exposed to a confirmed case of COVID-19, as informed by York Region Public Health or through the COVID Alert app, may be tested in an assessment center. And any individual who lives or works in a setting that has a COVID-19 outbreak is also eligible for testing in an assessment center. And there are some people that may be eligible for testing as part of a targeted testing initiative organized by the Ministry of Health or the Ministry of Long-Term Care. Next slide, please. So test results are available online for the PCR lab tests done at an assessment center. And employees can check their COVID-19 test results on the provincial website noted here. So those are for the tests that are performed at an assessment center. If the employee's PCR test is negative and they are not a close contact, in general, employees and those in their household may return to regular activities. So here we're talking about somebody who had a rapid antigen test. It was positive. They go to an assessment center for a confirmatory test. The test is negative. Then they can continue with their regular activities. But if an employee's PCR test is positive, York Region Public Health provides support and instructions on how to self-isolate and interviews the employee to inform contact tracing efforts. So if somebody has a positive rapid antigen test at the workplace, they go to an assessment center for the PCR test, and the PCR test is positive, that's confirmatory, and that individual has to self-isolate. And they'll have to self-isolate for at least 10 days from the beginning of symptom onset or the date of the positive PCR test if they happen to be asymptomatic or without symptoms. York Region Public Health and employers can notify exposed employees and patrons at the workplace who are considered to have been in close contact with the person who tested positive. Regardless of a test result, a close contact must self-isolate for 14 days from their last exposure to somebody who had a positive PCR test, unless they are fully vaccinated. Employees could require more time off should they have symptoms emerge during isolation. That would mean they would become a case of COVID-19 rather than just a close contact if the person develops symptoms while they were isolating. Close contacts will also need to get tested on or after day 7 or sooner if they develop symptoms. And for close contacts, those individuals who are in contact with the person within 48 hours of the rapid antigen test result should be self-isolating unless the person has a negative PCR test, the person that tested positive on the rapid antigen test. It's very important for employers to maintain privacy and confidentiality of the affected employees and patrons' personal health information. For example, using non-identifying language to notify others that a person who was in the workplace was infected or exposed to the COVID-19 virus. Next slide, please. As an employer, it is your responsibility under the Occupational Health and Safety Act to take every precaution reasonable to protect workers. All employers are required to review and update their COVID-19 safety plans. The Ontario government outlines a 5-step process to help guide you if there is a suspected or positive case in your workplace. It should be noted that the circumstances of each suspected or positive case are unique, which is why we emphasize employers' continued collaboration with York Region Public Health guidance and direction. So we see a number of steps here on the slide. Step 1 for an exposure in the workplace. So if you have somebody symptomatic in the workplace, exclude the symptomatic person from the workplace, or if they are a confirmed COVID-19 positive case. So somebody with confirmed symptoms here, we're talking about somebody with confirmed symptoms of COVID-19 or somebody who tested positive on a PCR test. So they may have tested positive on the rapid antigen test and then positive again on the PCR test. They have to be excluded from the workplace. Also, if a worker calls in sick or informs you of symptoms or informs you they had a close contact of someone with symptoms, please have them take the self-assessment screening test available on the Ontario government's website. Ask the worker to follow any recommendations given by the self-assessment tool, including being tested and self-isolating. If anyone shows symptoms in the workplace, they should return home and self-isolate immediately and take that self-assessment screening tool. Step 2, for follow-up is contact York Region Public Health for guidance immediately after you become aware of COVID-19 activity in your workplace. We will provide instructions and do contact tracing if required. Please report cases and contacts on the COVID-19 reporting form on the York Region website. Step 3 is to follow York Region Public Health direction on self-isolation and return to work directions and opportunities to support workers so that they are able to self-isolate. Workers who are considered employees under the Employment Standards Act also have the right to take job-protected infectious disease emergency leave if they must self-isolate because of COVID-19. Step 4 is informing any workers who may have been exposed to a positive employee. Employers should give all workers information about the date and time of the potential exposure and where it took place. Please maintain privacy and confidentiality of personal health information in the workplace. Step 5, please report to the Ministry of Labor, Training and Skills Development and the Workplace Safety Insurance Board. The employer must give notice in writing within 4 days if you were advised that one of your workers has tested positive for COVID-19 due to an exposure in the workplace to the Ministry of Labor. And also to the employer's Joint Health and Safety Committee or Health and Safety representative, and to the trade union, if any. You must also report any occupationally acquired illnesses to the WSIB within 3 days of receiving notification of the workplace-related illness. Next slide, please. So let's look at the COVID-19 workplace reporting form and returning to work after self-isolation. If you're a business owner or operator, York Region encourages employers to use the COVID-19 reporting form for workplaces that you see on the screen to report any known cases of COVID-19 that may have been at your workplace in the last 14 days. The form is available on our website at york.ca/COVID-19 for business. The form includes sections on reporting information in workplace setting, control measures, case information, close contacts, additional details that may be available, a sign-off and review. The information reported is received by York Region Public Health's outbreak team and reviewed by a case investigator for the collection of information needed to investigate a COVID-19 workplace exposure. Now, while workplace outbreaks have been declining recently due to vaccination and other public health measures, this reporting tool is still vital for tracking and understanding the scope of workplace outbreaks and understanding and containing the spread of COVID-19 outbreaks in the workplace. We need employers to continue this important process of reporting. York Region Public Health follows Ontario's Ministry of Health public health guidance on testing and clearing cases of COVID-19. As I mentioned previously, there are 2 reasons why a worker may be required to self-isolate. So one is if the employee is a confirmed case, which is generally a minimum of 10 days of self-isolation. And secondly, if there is a potential exposure to a COVID-19 case, and that isolation is generally 14 days. It's 4 extra days beyond the 10 days because people will, after exposure, may not develop symptoms or a positive test for 4 days after exposure. Individuals who have tested positive for COVID-19 are not required to receive a clearance test or letter from public health to return to work or daily activities after their self-isolation period is ended. Employees can download a letter of explanation from York Region which explains this. This letter is available on our website and can be presented to employers. Employees must abide by all public health direction and advice on when it is considered safe to return to work. Next slide, please. It is through your continued cooperation and diligence and your efforts that will help keep our York Region communities and workplaces safe. York Region and the Ontario government provide many online resources to support businesses and employees, and you can see some information here on our website, including a guide, the Ontario Guide to Antigen Point of Care Testing. When an individual becomes a case or close contact, York Region Public Health provides these individuals with comprehensive information, including details about the infection, steps they should be taking while self-isolating, and the date they would be considered cleared to leave isolation based on their symptom onset date or date of positive test if they had no symptoms. And this information can all be viewed at york.ca/COVID-19 positive. If your employees are unsure if you need to self-isolate or get tested, please contact York Region Public Health at the phone number here. Public health guidance is available on the Ministry of Health website. All workplaces implementing rapid antigen screening in Ontario must ensure the screen tests are used in accordance with the provincial guidance for antigen screening in Ontario and antigen point of care testing. For detailed information on testing, refer to the Ministry of Health COVID-19 provincial testing guidance update and guidance specific to testing and clearance. I would like to thank those businesses who are using the antigen screening test and again, I'd like to encourage businesses who are not using the test to review the eligibility criteria online at the provincial site and register for the free test kits. Next slide, please. Thank you. So I'll turn the webinar over to my colleague Tip right now.
Thank you very much, Dr. Genesov. Before we move on to the question and answer session, I would also like to invite you to review all 4 of the webinars that we have hosted. The webinar recordings are all available on our website and provide businesses with the information to help keep our businesses open and our workplaces and community safe. The website link is on the screen, york.ca/COVID-19 for business, and is a dedicated webpage for COVID-19 information for businesses. We will now move on to the question and answer session. And please do remember to identify the sector that you represent when posting in the Q&A box. Thank you. Next slide, please. So to start off the question and answer session, we do have a few questions that businesses have posed to us. So the first one is, what are the eligibility criteria for businesses who are interested in rapid antigen testing?
Thank you. So the best thing is to do is to review the eligibility criteria online and register on the website ontario.ca/testing on site. So that'll list all the eligibility criteria for businesses. Thank you.
Okay, and the next question, can I ask my employee for their vaccination status?
Thank you. That's a good question. So under Ontario's Occupational Health and Safety Act, as we know, employers are responsible to promote and provide a safe work environment. Businesses should focus on continuing to adhere to public health measures to help reduce transmission in the workplace, including promoting workplace testing, masking, physical distancing, proper cleaning and disinfection, hand hygiene, and other safety measures. When considering issues regarding employees' vaccination status and workplace vaccine policies, employers should consult with legal counsel to ensure compliance with Ontario laws. Next question.
So just to add to that question, there was another question that was posed regarding the vaccine status of visitors entering the premises, and if employers are legally allowed to ask visitors to provide vaccine verification.
So you can ask, but there's no obligation for the person to disclose personal health information.
Perfect. And the next question, if employees are fully vaccinated, do they need to wear masks or physically distance?
So employees are required to follow York Region Public Health direction on masking and physical distancing. So that continues even for fully vaccinated employees. So all the public health measures that are in place now still apply to fully vaccinated employees, including masking and physical distancing and hand hygiene.
Perfect. Next slide, please. So when are masks not required in the workplace?
Thank you. So this is detailed in the provincial regulation for step 3, which is Ontario Regulation 364/20, the rules for step 3. And you may want to have a look there for specific details. So some examples of when masks are not required include if the employee has a medical condition that inhibits their ability to wear a mask or face covering, or if they are unable to put on or remove their mask or face covering without the assistance of another person, or if they need to temporarily remove their mask or face covering while in the indoor area to receive services that require the removal of their mask or face covering, or to consume food or drink. Also, masks are not required when performing work for the business or an organization in an area that is not accessible to members of the public, and the workers are able to maintain a physical distance of at least 2 meters from every other person while in the indoor area. So workers can take off masks, or workers are not required to wear masks indoors in the workplace in an area that is not accessible to the public, as long as they are able to maintain a 2-meter distance from other persons in that indoor area in the workplace that is not open to the public. Next question.
What are the current capacity limits?
So in step 3, the current capacity limits for essential and non-essential retail have capacity limited to permit physical distance of 2 meters. So non-essential retail that are allowed to open, capacity is limited to where it's to allow physical distancing of 2 meters. For gatherings, a maximum of 100 people for outdoor gatherings and a maximum of 25 people for indoor gatherings is permitted. Next question.
For restaurants and bars, can you please confirm personal protective equipment and other requirements under step 3?
So indoor and outdoor dining with capacity limits to permit physical distancing of 2 meters, and there are other restrictions. So restaurants must not permit patrons to line up inside of the businesses unless maintaining 2 meters of physical distancing, and all patrons and staff must wear a mask or face covering that covers their mouth, nose, and chin. Restaurants must not permit patrons to line up outside of the business unless they are maintaining 2 meters of physical distancing. There are no limits on the number of people per table. However, the business must be configured so that patrons seated at different tables are separated by at least 2 meters or a plexiglass or some other impermeable barrier. Masking is required for any person in an indoor area, and patrons can remove their coverings to consume food or drink. Businesses must actively screen any dine-in patrons in accordance with the advice and recommendations and instructions of the Office of the Chief Medical Officer of Health Ontario before the patrons enter the establishment for dine-in service. And businesses must record the name and contact information of every patron, unless the patron only enters temporarily into the restaurant to place, pick up, or pay for a takeout order. Let me just ask Vito, do you have anything to add to that?
No, that's fine, Doctor.
Okay, thank you. Next question.
Perfect, thank you. And actually, just as a follow-up to that, we did receive a question from a caterer. So they are going into people's homes to provide catering services, and they just had a question: what can they do about guests that are not wearing masks or maintaining distancing?
Vito, can you answer that?
Yeah, thank you, Doctor, and thank you, Tiv. There's 2 layers to the question. One is it's someone's personal home, so it's always difficult to try to apply the Ontario regulation towards the home. But in essence, you as a person going in to provide a service to the home could lay those conditions out right up front, saying the expectations that we're going to be compliant with the regulations, including requirements for masking indoors and also seating arrangements, and also sort of the the need for people to wear face coverings and be physically distanced. Now, I say all that, it's difficult when it's somebody's house in terms of where does someone's private home stop and start. But the second a business walks in, you're within your right to put expectations on your staff and put expectations on the guests that are there.
Thank you.
Thanks, Theo. Thanks, Dr. Genesov. We have a couple of questions about staff being vaccinated. So one of them is having previously tested positive for COVID-19 equivalent to being vaccinated?
No. So there's a few issues here. So first, the best thing is for everybody to be fully vaccinated for COVID-19. So I encourage people that were previously positive for COVID-19 to become fully vaccinated. It's not a contraindication to being vaccinated. It's really important for people that have had COVID-19 in the past to receive their full vaccinations. There's a number of reasons for that. One is we don't know how long the immunity lasts in a person who's had a case of COVID-19. The immunity may decrease very quickly. And also for somebody who's had COVID-19, they may be potentially susceptible to some of the new variants, and the vaccine will provide more protection for that. Also, there have been some cases of reinfection in people that have had COVID-19 in the past. These are a small number of cases, but they have occurred where people who've had COVID-19 in the past have become reinfected with COVID-19. So it's really important for everyone, including people who've had COVID-19 in the past, to receive both vaccinations. Thank you.
Thank you. So this next question comes from the sports and recreation business. So they have employees that are providing services within 2 meters and are wearing all necessary PPE per guidelines. And they have approximately 60 to 65% of their employees that are vaccinated. Their question is if they're wondering if they're able to mandate rapid testing for their employees.
For rapid testing? So yes, you can implement the rapid testing program in the workplace. That's that's what we've been talking about today. In terms of how you're going to make it mandatory, again, it's like vaccination policy. You really have to discuss with your legal counsel what applies in your own specific workplace. Every workplace is individual. Some people have work agreements, contracts, or collective agreements, and that has to be taken into consideration. So again, it's really important to implement rapid antigen testing in workplaces, but in terms of making it mandatory for folks, that's something you'll have to discuss with your legal counsel. Okay.
Okay. I'll just ask this last question on the slide here. Is there going to be a step 4?
That's a good question. So hopefully it will come soon, but it depends on the vaccination rate in the province. The province of Ontario is looking at the global vaccination rate in Ontario, plus other health measures when considering moving into step 4. So the province's roadmap to reopen it at this point is a 3-step plan to safely and cautiously reopen the province and gradually lift the public health restrictions. The Ontario Chief Medical Officer of Health, Dr. Kieran Moore, has suggested that he would like to see at this point, he'd like to see higher vaccination coverage to help address the Delta variant. So it's important that businesses continue to follow all the public health measures that are in place now. I imagine in step 4, a lot of the restrictions will be lifted. There'll still be some restrictions in place to keep us safe, but we don't have details of when step 4 will start or what the requirements will be. We do know that Ontario is looking at a higher vaccination rate in the province to get into step 4. That's all we have. That's all the information we have for now, unfortunately. Yeah, thank you for the question.
Okay. Another question on vaccine status. Do close contacts still self-isolate after being double vaccinated?
No, so close contacts that are fully vaccinated. That means that they've had both doses of vaccine and at least 14 days have passed since the second dose. Those folks that are fully vaccinated do not have to self-isolate after a close contact.
Perfect, thank you. And then we have a couple of questions about customers. And so one is, can you deny service to a customer who cannot wear a mask due to legitimate medical condition?
Vito, would you like to start with that one?
Yes, thank you, Doctor. Thank you for the question. So the legislation suggests that there is an exemption for someone who has a medical condition. As our doctor referenced, you have no legal authority to demand someone's confirmation of that exemption. But to answer the question, can you deny someone service or access to your business because they're not wearing a mask? That's something that you need to talk to with your ownership and your legal counsel in terms of whether you deny someone's access. I can tell you that the legislation provides an exemption. The question as to whether you deny someone's service or allow them not to shop hypothetically in your store, that's something that you need to do in consultation with your legal counsel.
Thank you. So I'll just add that there's issues here around human rights. You can take a look at the Ontario Human Rights website for some details. And again, as Vito mentioned, you really have to speak with your legal counsel to look at how that applies in your workplace and what type of accommodation you may or may not be able to provide. Thank you for the question.
Okay, and then another question. For restaurant patios, they are not screening or keeping contact information. Are they required to?
Vito?
Thank you, Doctor, and thank you, Tib, and thank you for the question. If a patio or a indoor dining where there is service, so in other words, there's a waiter or a waitress that provides service, whether you're indoor or outdoor, the expectation is that the person is screened and that there is documentation saying that this person ate here at this time and this date, and there's also contact information. If it is a patio or seating arrangement where I pick up my food cafeteria style, or I go into a coffee shop and pick up my own coffee and sit down on my own, then there isn't an expectation that I need to maintain names and numbers of individuals who sat there.
Thank you.
Thanks, Vito.
Okay.
And we have a question. Is rapid antigen test the same as PCR?
No, it's a different process. So rapid antigen test, there's two general types of kits, PanBio and Abbott, and the test, if it's performed in the workplace or on site, will give the results in 15 minutes. PCR test is generally a lab-based test where one goes to an assessment center or is tested by a specific health provider, and the swab that's taken is sent to a laboratory for analysis, and it usually takes 24 to 48 hours to get the result back. The PCR test is much more accurate than the rapid antigen test. So there are two different tests. Thank you.
Thank you, Dr. Genesov. We have another question for religious organizations. As groups resume using meeting spaces, what are the obligations of the operator of the meeting space?
Vito? Thanks,
Doctor, and thanks, Tiv. I'm kind of hesitating because it depends on what the question's asking. Is there a religious ceremony happening, or is a room being rented out for the purpose of hosting a birthday party? So I'll answer the ceremony question, and if the person asking the question has a different sort of layers to the question, please add to it. In terms of if it's a religious ceremony, they need a COVID safety plan. They need to ensure that their COVID safety plan is such that people are 2 meters apart, and that people leave the location and come into the location in such a way that they're not sort of, interacting with each other as little as possible. But having said that, there isn't per se a capacity limit that has a ceiling. It's based on the size of your facility and based on your capacity to keep people a certain distance apart that aren't from the same household. If the request is about renting out a room for the purpose of a meeting or event, whether it's a birthday party or whatever the case may be, then it's based on capacity limits of the room. It's up to 50% of the room capacity, and depending on how big the room is, there's a ceiling of up to 1,000, but that's a very, very big facility if that's the case. But I'll stop there, and if there's layers to the question that need to be added, then please do so.
So it's just added on to it. No room use by groups. Groups that use for free for meetings.
Ask it again, please, Tiv.
Sorry, it's room use by groups that use it for free for meetings. So I think it's just a general space.
So if it's a community room, then it would fall under a meeting and event, whether there is a rental arrangement, or whether it's sort of given as part of a charitable component. There is the maximum capacity to that room as of the regulation as we have it right now is 50% of room capacity. Based on fire code, up to 1,000 people for the facility. Now, I say that it's more likely that it's 50% of the room capacity. And with that, also there has to be a COVID plan. You need to post your capacity and have all the relevant signage in place, and consider things like common washroom use and all those things as you design your sort of capacity limit. But to answer the question, yes, those rooms can be used for the purpose of meeting and events.
Perfect. Thank you, Vito.
Okay.
Unfortunately, we have run out of time. Thank you for all of you who have posed questions in the chat. Before we end the session, I just wanted to thank everyone for doing your part to stop the spread of COVID-19. And I also wanted to thank our speakers, Dr. Genisov and Vito Shafari.
Thank you.
Thank you.
Thank you, everyone. Have a great day.
Bye-bye.